to Public Health America, a weekly program produced by BronxNet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. I'm very pleased to have with us today Dr. Ashley Grosso, Assistant Professor in the Department of Urban Global Public Health at Rutgers University. Ashley, welcome to the program.
Thank you.
You're very welcome. Great to have you. So I know you've been doing some cutting edge work on reproductive health in the US and Africa and beyond. Why don't you set the table and tell us a little bit about your work?
Sure. So I study HIV and sexual and reproductive health among key populations, including sex workers and men who have sex with men, some of which is in sub-Saharan Africa, which has a very high HIV prevalence. And I'm interested in adolescents in particular, those under the age of 18. So among our research with adult key populations, we asked them questions about the age at which they initiated risk behaviors or experienced vulnerabilities. And when we compared those, particularly among the sex workers, those who started when they were under the age of 18 compared to those who started with adults, we found that they had early vulnerabilities, such as being orphaned, having low education, giving birth as a teenager, and continued vulnerabilities, such as experiencing violence, depression, sexually transmitted infections, and so on. Then among the men who have sex with men, we found that a high proportion had started having sex before the age of 18, but they would be excluded from research often because parental consent is generally required for participation. And these youth were generally not out about their sexual orientation to their parents, or if they had disclosed, their parents and their families had stigmatized them or even committed violence against them. So that led me to my current work looking at the barriers to inclusion of key populations under the age of 18 in HIV research in sub-Saharan Africa.
That's a great topic and very important. So what are some of the barriers? I know, so basically we're partially looking at difficult to reach populations that are highly vulnerable by virtue of any number of factors that it could include sexual orientation, or different very high risk histories in their childhood youth. So how do we, tell us a little bit about what countries you're doing this work in, if it's sub-Saharan Africa, and what are some of the barriers to gaining access so you can get better data?
Sure. So my current project is in 48 countries in sub-Saharan Africa. So it's everywhere except for North Africa. And one of the barriers we're looking at is research ethics guidance on the inclusion of youth in research without parental consent. So there are some countries where there are no exceptions at all. There are some countries where if a minor under 18 is emancipated or married or pregnant or parenting, they can participate in research. And there are other studies where if the topic is on substance use or on sexual and reproductive health, then a minor under 18 can consent for themselves to participate. But there's also some leeway within that. So we're also looking at with a literature review to see where research has been conducted with underage key populations, what types of research, what are the gaps, and then we'll be surveying the researchers to ask them, why did you include or exclude underage participants? What were the challenges if you did? And finally, we'll be talking with research ethics committee members. So in some places, there's some leeway that the institutional review boards or research ethics committees can waive parental consent or set conditions for minors to participate in this research. So getting a better picture of the different stakeholders in this work. I'll also add that criminalization of sex work and criminalization of same-sex practices in many of the countries where I'm working are very difficult as well. So not only are these behaviors stigmatized, not only are these youth vulnerable, but they could actually be arrested, even though particularly among those selling sex, they are not old enough to consent to sex work. They're considered sex trafficked or commercially sexually exploited, but they could risk arrest.
Sure. So that's obviously you're talking about a lot of exceedingly complicated things. So if someone under 18 in one of 48 countries in sub-Saharan Africa or Africa were married, pregnant, or emancipated, maybe they could participate in the research. But my guess would be that a lot are not married, pregnant, or emancipated. So what do you do with the rest?
Correct. So we're looking at what are the other circumstances. Again, sometimes the topic area of the research, if it's on child abuse, there might be a waiver of parental consent because you wouldn't want that youth disclosing to their parents, participating in that. Sometimes if the research is on, for example, HIV testing and the law allows minors to consent for HIV testing themselves, then they can participate. So this is something we're trying to get a bigger picture of. And then there are some countries, for example, in Mozambique, there are no exceptions written into the law, but I know that there have been studies, including conducted by people I'm partnering with for this research, that have been conducted with underage populations. So we're looking to see what are the circumstances under which that can happen. How can that be done in an ethical way? Well, we're including these participants in research so they can get these benefits and interventions, but also protect them and protect their rights and make sure that they're not being taken advantage of.
Mm-hmm. You bring up the issue of criminalization of sex work. Boy, that just seems like a really tough one. I mean, obviously we all know of a lot of agencies nationally that are working tirelessly to stop sex trafficking of children. And I'll certainly go on record to say I think that work needs to be done. I think what's implicit in what you're saying, but I want you to explain it to me in a way that hopefully I can understand, is that we don't want to punish a young person for doing something that they may have been coerced to do, or on some level they were coerced to do. We got to go after the sex traffickers, not the children. What we got to do is get them out of sex trafficking and get them the services that they need. Am I closer? How do you deal with the tension between wanting? I mean, I don't even know how I could say the sentence decriminalize sex work. I don't know how that would make sense in my head. But that doesn't mean I want to send a 14-year-old girl to prison for something that she was forced to do. I want to send the person that made her do that go to prison. So how do you tweeze that out?
Right. So it's very complicated, right? So in some cases, we do see that these youth have a pimp or someone who has pressured or coerced them into selling sex. They didn't make that decision on their own. But sometimes there are other complications. So as I mentioned, many of them have been orphaned as children. They have very low education. They gave birth as a teenager. So it's actually an economic driver that's pushing them into selling sex rather than being coerced. But they don't have many choices in the situation still. So I wish it was as simple as we just get the traffickers, we catch the bad guys, but there are a lot of other social and economic issues involved. And the reason that criminalization of sex work is difficult is not only that these young people could be arrested, but even if you had, for example, adult sex workers and they knew of a scenario where someone was trafficked or there was someone underage selling sex, if they wanted to report that to police, they might be reluctant to do so because they themselves could be arrested as a sex worker.
Mm-hmm. Sure. Let's focus for a moment on a comment you made a bit ago about how some countries have no exceptions to allowing someone under 18 to participate in research and others do. Can you give an example or two of that just to try to understand what the differences are that allow the exceptions to be made?
Sure. So, for example, in Ethiopia, the exceptions again include the topic of the research or the characteristics of the minor. In some cases, like in Somaliland, they do not have research ethics guidelines at all. That's something they're working to build. So, it's not allowed and it's not forbidden. And as I mentioned again, in Mozambique, there are no exceptions explicitly written into the law. As another example, in Cote d'Ivoire, there's not specific research ethics guidance on this, but their overall law is about contract supply. So the age of majority applies. If you would have been able to consent to something else as an adult, then you would also be considered an adult or not a minor for the purpose of research.
This may be a bit of a naive question, but are there any efforts to have sort of national conferences that bring, public health or the appropriate, ministries of health, et cetera, together across countries and try to develop some semblance of standard, or is it just too difficult to do that at this phase?
Well, that's something that I'm actually also trying to do with this work. So I have partnered with an advisory board of members from each country, and some of them are members of Ministry of Health or National HIV/AIDS Council. Some of them are members of non-governmental organizations that advocate for the rights of children or people with HIV or sex workers or LGBT people. And so I'm hoping that by bringing these groups together to engage in this research, we can start to learn lessons from various country contexts, and we'll be conducting focus groups with, again, researchers and ethics committee members to try to develop some recommendations and best practices.
Got it. So at the very outset, you had mentioned that in a number of studies that you and others have conducted, that not surprisingly, young adults or children that get involved in sex work and or other high-risk behaviors for financial reasons or otherwise also exhibit a wide range of risk factors from birth onward, being orphaned, poor education, abuse during childhood. So what proportion of your work is focused on prevention, treatment? What are the solutions there that are being put into place?
Right. So the reason I'm conducting this research now is to identify the places where we can legally and ethically conduct research with these youth. Definitely there's some work being done on prevention, strengthening child protective systems, providing financial incentives to families and youth to try and prevent entry into selling sex. But then also I think we need harm reduction interventions for those who are already selling sex to either get them out of the sex trade or if they are not able to get out of that situation, to provide health services, because we also find they're much less likely to uptake HIV testing, sexually transmitted infection testing, other preventative and treatment things. So I think that there needs to be both prevention and getting people out of this situation or providing services for them.
And one final question before we move on to the next segment, and it's what I might have asked you at the very beginning. Do we have any sense of prevalence of sex trade among minors, what we would consider someone under 18, across the large swath of countries that you're studying in?
There are some data from population-based surveys. We presented this at the International AIDS Conference this year from about 6 countries. And among 15 to 17-year-olds, the prevalence was about 1% overall among girls. That ranged from as low as about 0.2% to as high as about 4%, depending on the country, and a slightly lower prevalence among boys among that age group.
Mm.
And then among the adult sex workers, when we asked them at what age they started, we found anywhere from about 10% to about 48% started when they were under the age of 18. Got
it. And since you do some work in the United States, how would that compare to the States in terms of those prevalences by age, by gender?
Sure. I'm not familiar that much with the prevalence within the U.S., but again, the circumstances are somewhat different. You might have more runaway youth or youth using drugs in the U.S., and while that sometimes also happens in sub-Saharan Africa, I think the levels of poverty are definitely a big driver.
Sure. Well, we're going to take a quick break, but when we return, Ashley will tell us a little bit about her life story and as it relates to her undergraduate college experience and other educational experiences and how they provided the opportunity for her to develop a profession and do the great work that she's doing. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back.
You can talk to me if you're feeling sad.
Thanks for hearing me out, bro.
Whenever you need to talk, I'm here, okay?
How do you know when you've made the right decision? It's the feeling you get in your gut, the one that tells you what's right or wrong. It's the one that says, sure, I can have a drink, or the feeling that says, okay, I've been drinking, now what? It's the voice inside you that says, I'm buzzed, better leave the car when it's time to go. Plan ahead, catch a sober ride. Buzz driving is drunk driving.
You can now watch MNN, Brick TV, QPTV, and SIC TV on BronxNet. Tune in to BX Omni, Channel 67 Optimum, 2133 Fios during most Sunday evenings. We'll show you some amazing content from our friends at Manhattan Neighborhood Network, Brick TV in Brooklyn, Queens Public Television, and Staten Island Community Television. Every borough represented in the Boogie Down. Epic partnerships for the ages. And catch our new Next channel, produced in partnership with MNN, 24/7 on BronxNet Channel 952 Optimum and 2138 Fios.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So Ashley, we always start this part of the segment with the same question, which is, tell us where you were born and about some of your formative experiences.
Thank you. I was born in the Syracuse, New York area, and I grew up in a rural community called Codnoy. It's a hamlet with fewer than 500 people, very community oriented. And my parents did not go to college, but they always encouraged me and my younger brother to do well in school and to pursue higher education.
That's great. So when you were, heading your way through high school, what sort of process did you utilize to look at colleges and to ultimately pick one?
Well, I was going to the guidance office quite frequently. I was always paying attention to academic scholarships. I did well with my grades, so I was able to look at that. So there were definitely financial considerations. I also was a senior in high school on September 11th, 2001. So the terrorist attacks of 9/11 were an impactful experience for me. And so that actually made me decide to study diplomacy and international relations, because during this difficult time for the world, I wanted to make a difference and try to help the global community.
Okay, and then ultimately, where did you attend, and what was your experience like?
I attended Seton Hall University in South Orange, New Jersey, and I took advantage of a lot of opportunities there. One was the Federal Work Study program, which I would encourage any people to take advantage of. So I worked at our nonprofit sector resource institute there at the university, and that's how I got more involved in the nonprofit community, and that actually led me to pursue my master's in nonprofit management. I also was able to complete a number of internships. So our School of Diplomacy and International Relations had partnerships with the United Nations. So I was able to intern at the World Health Organization office at the United Nations in New York. And I also got involved in a lot of clubs and organizations. So for example, we started a Red Cross club on campus that did a lot of work on HIV awareness. And that's how I got into narrowing that down for my topic of research, both globally and locally in our community, primarily with the volunteer work I did in Newark, New Jersey, nearby the university.
Sure. That sounds like a fantastic experience. So what was your major?
Diplomacy and international relations.
Okay. Okay. And what that is a major that I think a lot of educated people would immediately kind of intuitively grasp what that means, but I bet a lot of 18-year-olds might not. What led you to that direction? What experiences made you aware of that as an opportunity? Could have been in high school or could have been when you were 5. Just
Right.
what led you there?
Yeah, well, like I said, I think that after 9/11, I got more interested in watching the news and paying attention to global affairs, and that was when I decided to move in that direction. Also, as I mentioned, I was from a small rural community, so I wanted to go out and see the world, go out and change the world. So when I was there, I studied, again, global health. There were some economics classes, political science classes, things like that.
Sounds good. And it seems like a very significant theme in your undergraduate experience, which sounds exceedingly positive, is experiential learning broadly defined. Like it sounds like you did a lot of stuff. And you were very clear in one example that informed that experiential learning opportunity informed getting a master's. So talk a little bit about just what led you to move in that direction to get those experiences. What were the kinds of mentors that you had, and how did that help as your career unfolded?
Thanks. Yeah, and actually, I did some service learning courses as well. So I did a minor in nonprofit studies, and the director of that program, Dr. Roseanne Mirabella, was a mentor to me. And so what we did was she would match local nonprofit organizations with classes on a particular theme. So for example, fundraising, and the students would complete a project. So we worked on strategic planning or identifying funders or writing draft grant applications, so that it was beneficial to both the student learning experience as well as the nonprofit with their community identified need that they could use some student help with.
Sounds good. And who did you face any challenges either getting to college, funding college, or the experience itself?
Yes. So as I mentioned, I had a full tuition scholarship, thankfully, but I did have room and board and things to cover. The New York, New Jersey area was very expensive. And then I went straight through to get my master's and my PhD. Again, got a number of scholarships, but still had to take out some student loans. So I actually just on Saturday had my loans forgiven through the Public Service Loan Forgiveness Program. So I would highly encourage people to look into that option, that if you work in a government or nonprofit organization for 10 years, you can have the balance of your student loans forgiven. I also received a National Institutes of Health Loan Repayment Program award, which also pays down some of your debt for those who work in doctoral level public health research.
Well, that's great advice for our viewers to look into those things at various phases of their educational development. So you do your undergrad, you go straight into your master's, right? And then what did you do after that? And at what point did you pursue the doctorate?
I did go straight from undergraduate to master's to doctorate. I would say that I decided on the doctorate. One of the last classes I took in my nonprofit management degree was program design and evaluation. And I really wanted to do more of that evaluation and research of programs. So I decided to pursue the PhD to get the research skills. And I did my PhD in public administration. So even though I work in public health, all of my degrees are in something different. So I look at health more from a lens of with the public administration, and as we talked about earlier, public policies and how those affect health, and then how those are implemented and evaluating the effects of those.
And so you did your undergrad at Seton Hall. Where'd you do your master's?
At the New School in New York.
Okay. And where'd you do your doctorate?
At Rutgers University, where I am currently.
Got it. Great. And tell us a little bit about the role of public administration. Like, what does that major mean compared to, say, epidemiology or biostatistics or other, traditional public health majors?
So it's very focused on public policies and their implementation and the role of public servants, or what we would say street level bureaucrats. So you get in some of the examples I mentioned with my research, police, healthcare workers have an influence on health. My research in the US is actually focused on HIV education in schools. So teachers and school nurses are also sort of these street level bureaucrats that can have a role in promoting public health. And then also looking at the, as I said, implementation of policy. So in my US research, I look at whether states mandate HIV education, but then also, is that actually carried out? So we look at surveys from the Centers for Disease Control and Prevention to see what proportion of schools actually teach HIV prevention in high school. So I would say overall, the looking at policy and the implementation of policy, and then my lens on that is looking at then the effects of that on health.
Excellent. That's a great summary. And I think it's helpful for our viewers to sort of understand the variation of various areas of expertise within a given discipline. So like public health, now by virtue of the pandemic, I think a lot of people think about the epidemiology side of public health, but really there are multiple sides of public health, and public administration is certainly one of them. We're coming up on the last minute or so. I've got a couple questions left. Tell us a little about your doctoral experience, just like what work did you do with your mentor or mentors? How important was that to figuring out next steps?
Yeah, so I was lucky to have a fellowship, so I had some flexibility to do a lot of things that I wanted and not be a teaching assistant or something. So my doctoral advisor, Dr. Greg Van Ryzen, I was a research assistant with him. We worked together in the summers. I contributed to working on his survey research and got experience in different topics, and then did some independent studies to pursue some of my own research. So I was always very interested in research and going on a not necessarily traditional academic path. I did eventually work for a nonprofit and a for-profit, really working in research. So tried to get as many research experiences as I could in the doctoral program.
That's great. And with just a few seconds left, if you had some advice to give to a young person today who maybe is on the fence about attending college, maybe it's because they are looking at the value proposition and there are people telling them, oh, go work at Amazon for $25 an hour. You're going to get all this debt when you go to college. What guidance would you give to young people today about whether or not to attend college?
I would definitely encourage it. And I would say, again, that there are financial opportunities and you have to be proactive in looking out for them. But really, I think it will give you the skills and the experiences to pursue your dreams, whatever they are.
That's great. So I want to thank Dr. Ashley Grosso for joining us today and sharing her excellent research and her personal journey in education that provided the basis to do the excellent work she's doing. I want to thank our viewers for tuning in. This is Public Health America. I'm your host, Dr. William Latimer. We'll see you next time, and until then, take care.